guys, my name is Matthew James. I'm a doctor of physical therapy here at Specialized Physical Therapy. I'm also with Dr. Paul Vidal, who's the owner of Specialized Physical Therapy. Today what I'd like to do is just talk to you a little bit about the overhead throwing athlete. Over the next couple of weeks, what we're going to do is we're going to be putting together a few video clips of different pathologies and injuries that you typically see with the overhead throwing athlete. And then hopefully give you some interventions or some exercises that you can use to help prevent or treat some of those injuries. So when we talk about the overhead throwing athlete, that is an individual that is predisposed to various shoulder and elbow pathologies. That's different to compared to other athletes. When we talk about the injuries in those athletes, we do occasionally see some traumatic injuries. Why they continue to have pain and symptoms. We think about things like overuse, fatigue, poor training programs, poor body mechanics, and not enough recovery and rest time. So one of the things I'd like to talk to you guys today about first is something that's commonly talked about in the literature and in sports in general, is what we call GERD, or glenohumeral internal rotation deficits. So with the shoulder, we have what we call internal rotation, which is basically turning the arm in, and we have external rotation. And in the overhead throwing athlete, they typically have more external rotation as compared to internal rotation. So GIRD is glenohumeral internal rotation deficits. When that happens, what we know is if you have less than 5 degrees difference compared to the throwing arm, comparing the throwing arm to the non-throwing arm, those athletes are at risk for further shoulder and elbow injuries. So what I'd like to do is I'm going to go over what we call the modified sleeper stretch. And this is a specific exercise that targets the posterior part of the shoulder, and specifically the musculature as well as the joint capsule in the back of the glenohumeral joint. What you would have the athlete do is basically lie on their side. They're going to take their arm up to about 90 degrees, their shoulder to 90 degrees, as well as their elbow. And then the athlete from this position is going to roll backwards about the vertical. And then they're going to take their opposite hand and they're going to just gently press down, just like that, until they feel a stretch in the posterior part of the shoulder. So they're going to hold that stretch for about 30 seconds, and we're going to repeat that 3 times. So again, this stretch is to help increase the internal rotation moment of the shoulder, which allows the athlete to kind of go all the way through the motion without placing excessive stress on the shoulder. So hopefully you guys can get something out of this and use this and implement it right away into what you're already doing in your workouts. If you guys have any other questions, you can always contact your local physical therapist. And we look forward to giving you guys a couple more video shorts about the overhead throwing athlete, shoulder injuries, elbow injuries, and some injury prevention techniques. Thanks a lot.